Hello everyone, myself Dr. Shamsa Fayaz, working as professor and HOD in National Institute of Ayurveda, Jaipur. Today I would like to discuss a case of capillary haemangioma in the tongue. This is a congenital condition wherein the patient was having since birth, and as he grew it increased in size, and when he approached to me, the patient had difficulty in speaking because of the restricted mobility, and that is why he was not his speech was not fluent, and we couldn't know his speech fluently. So the patient had approached many hospitals wherein he was advised surgery, but the drawback of surgery was that he would lose his voice. So that is why he approached our hospital, and looking at the condition, it was diagnosed as Rakta and Pittaja condition. So for this, the one of the best choice of treatment is Rakta Mokshan. So this Rakta Mokshan, the lesions were more on the dorsal surface, lateral surface of the tongue, especially on the right side, and as well as on the under surface of the tongue. So initially we started the treatment on the dorsal surface of the tongue. So Jaloka Charan was done on these areas wherever there was this capillary hemangioma, and along with that we had to do Siraved also to some areas, especially in the dorsal surface of the tongue, to promote better bloodletting, especially in the venous areas wherever there was bluish veins. We did this Siraved with this needle, and the patient got very good response after the treatment. So because whenever we are doing it in the oral cavity, we should be extra careful to see that there are no adverse effects, and the bleeding also should be well controlled, and sometimes there may also be complications, so you have to be very careful while you are doing this procedure. But the results are very satisfactory, and you can give the surgical outcome in those patients where we can manage easily with this Jalokavacharana or Siraved Chikitsa, and definitely the patient will get better result. Even his voice also will not be lost, because that is the main drawback when we go for surgery. So in this way the patient got very good relief after doing all these procedures. So if we plan Ayurvedic treatment efficiently in a better way, definitely we can give a very good result.